Ian Banks, Chair of the European Forum Against Blindness. What are the issues for you?
Perhaps the most important issue for this House, this Parliament, and for all of Europe is the simple fact that 80% of blindness is actually preventable. And if we can remember that, and if we have the will to actually do something about it, we could improve the health of people right across Europe. That is the big issue, prevention.
And what would you like to do? Would it be a public information campaign, educating the public? What are the solutions?
There are many ways of approaching this. There are many ways that we can have solutions to this really quite simple situation of prevention of blindness. Perhaps the best way of approaching this is awareness. First of all, to make people aware, not least the politicians, not least the policymakers, but also healthcare professionals, and indeed people themselves, that you needn't go blind, that people do not need to go blind. There is always, in 80% of the cases, a way of preventing that blindness in the first place. So things like awareness programs are hugely important. But then we need to look also, obviously, at things like screening programs, screening for retinopathy from diabetes, for instance. With the epidemic of diabetes that we have at the moment, we are bound to see an even higher level of blindness as a result. So screening really makes sense on those people who we know either have diabetes or are more likely to develop diabetes in the first place.
You're in the European Parliament today. What can the European Parliament do? What can the European Union do to help?
The European Parliament can no longer hide behind ignorance. There is no excuse anymore for lack of action. We know the statistics are there, and we know what the economic and humanitarian impact is of this preventable blindness. The European Parliament now needs to take action, and that action will involve, obviously, an awareness campaign amongst healthcare professionals, policymakers, people themselves, about how preventable blindness actually is, and then to actually act upon it in terms of things like screening for diabetic retinopathy, for instance, early intervention through early diagnosis to prevent the blindness which otherwise will take place. There is a huge weight, if you like, on the shoulders of each and every MEP in this House, this Parliament, to make sure that in their country and of all of Europe, that these 80% of blindness are prevented, and that people do not need to go blind in Europe.